Now on News 6, education in a pandemic. The teachers.
Nobody has been able to tell me practically how it's going to work.
The parents.
We are just basically in limbo at this moment.
The students.
They can pick up on that stress, that anxiety, that worry that we as parents carry.
The leaders.
The goal should be to get kids back in the classroom.
On the line, your child's education and your family's health.
We don't want to make the pandemic worse.
Reopening schools, your questions answered on News 6 Getting Results starts now.
Brought to you by the Orlando Law Group.
And thank you for joining News 6 Getting Results for this primetime special, Reopening Schools, Your Questions Answered. I'm News 6 anchor Lisa Bell, and as a parent, like so many of you watching, I have questions about what the upcoming school year will look like during these uncertain times. So tonight, News 6 is joined by a panel of experts to help us navigate through some of the unknowns. Here with us tonight, Orange County Public Schools Superintendent Dr. Barbara Jenkins, Seminole County Public Schools Superintendent Dr. Walt Griffin, Osceola County School Board Chairman Kelvin Soto, Brevard County 6th grade teacher Rebecca Horton, and Dr. Annette Nielsen from Treehouse Pediatrics. And while this discussion is going on live on TV, be sure to join our live chat happening right now at clickorlando.com/reopening schools. There you can ask questions to our panelists, find back to school resources, and join our conversation tonight. And that conversation begins with our first question to each of you tonight. Leaders here in Florida and the federal government keep stressing that brick and mortar schools need to reopen 5 days a week. Why is now the right time to reopen schools? Dr. Jenkins, will begin with you.
So that's certainly an excellent question. I would have probably preferred to delay opening beyond what the state required, but the bottom line is, by emergency order, the state of Florida has in place that schools will be open, brick and mortar, face-to-face, in August. That's why.
Dr. Griffin?
We are following the same emergency order. We have to open schools and have that an option for all families 5 days a week, and it has to happen in August. I don't write the law, I follow the law, and that's what we are prepared to do.
All right, and Chairman Soto?
I don't believe that the emergency order is based on science. With what we know today about coronavirus and what we're learning about it as time goes on, it is absolutely not a science-based decision to open schools back up. I certainly understand what the superintendents and myself are tasked to do, and we will do the best that we can.
I do want to add that the state has followed up that these day-to-day decisions to open or close a school must always rest locally with the board or executive most closely associated. You still feel like you have no wiggle room in terms of reopening right now?
I'll take that question. It certainly doesn't feel that way. It's we have a constant here, which is our scientific understanding of COVID-19 and the coronavirus. We understand its effects on the human body, its transmission rates. We are understanding now more than ever that children are reasonable and very effective hosts. And so basically to say that the decision is in our hands, but we don't have the support of the local or the state or the federal government to help us make the right decision, it's pyrrhic in a sense. It's not real. It's not real. So what we want to do is we want to comply, and we want to do the best we can and follow guidelines and try to make a safe environment as possible for our staff and our students.
Dr. Nielsen, you're a pediatrician. Your thoughts on opening schools right now?
We have no business opening schools right now. Dr. Jenkins, she's said it brilliantly. She's following what she perceives as to be the executive order and the law. The problem is that the law also is to be based on the Constitution, and the Constitution of the state of Florida says that the state of Florida is required to protect the people who live here, the students, the teachers, every individual in the state of Florida. And so we're violating the Constitution by opening schools. we have no business opening schools.
And Mrs. Horton, you're a 6th grade teacher. Your thoughts on opening brick and mortar schools right now?
I think it's important for the students, but if I had my choice, I would really like to delay it maybe another 9 weeks or so.
All right. And Dr. Griffin, just today you proposed modifying the district's face mask policy. I want each of the school leaders to briefly tell us their policy as kids get ready to head back to school. And also we have a question from a teacher who wants to know what she can do if a student either refuses to wear a mask in the classroom or wears one improperly by exposing their mouth and nose. Additionally, she's wondering if she will still need to teach children with mask exemptions.
Okay, well, the first part of the question is, yes, today I did put out to our entire school community that next week I'll be bringing a recommendation on our August 11th board meeting to really tighten up our mask protocol. That is not my opinion. That is after a lot of work with medical officials who understand the respiratory droplets are the main cause of COVID, and this is being put in place to protect our employees and protect our students. We do have options if families do not want their children wearing masks in situations where we cannot socially distance them. There are 4 options in Seminole County. If they don't want the face-to-face option, I respect that. We have a program called Seminole Connect. That is our remote program. We also have a hybrid program, and we have a virtual school that parents can opt for. We are allowing, since we are modifying this, and I anticipate there'll be additional modifications. This whole situation changes constantly, and I believe that my role is the health and safety of all our employees and students, and if we have to make changes, not afraid to make those changes. I do know that if schools were designed for social distancing, this would be a lot easier. They're not. Schools are designed for social interaction. So even though about only 44% of our students are returning to school, I felt it was important to make sure that we did everything that we could to prevent the spread of COVID. As far as the question from the teacher, what will happen? Part of what we will be rolling out are the exact protocols. Students who do not have masks at school, we will work with them to have them wear a mask. If not, their parents may have to make another option for them other than face-to-face.
And in terms of enforcing it, if a student is not wearing it properly, or if a student has a mask exemption, will that teacher be required to enforce it, and will they have to teach students with mask exemptions?
Yeah, there are many accommodations for students that have mask exemptions. Spoke to a parent today who has a special needs child who will. The child will be wearing a shield. The shields are not as effective as the mask, but we also purchased 25,000 desk shields. And students who are exempt or there are other issues, we will put a desk shield around them when they are working at their desk or working with other students, or when the teacher is working with them, we'll have a shield available for the teacher.
And Dr. Jenkins, OCPS's current mask policy, can you get us up to date on that?
We are actually bringing an emergency policy so that we will enforce our mask requirement by the Code of Student Conduct. And so we are, much like Seminole County, masks are required throughout the day. And we would expect exemptions to be few and far between, and we'll make the similar accommodations as Dr. Griffin mentioned.
And Chairman Soto?
We've invested a lot into an education program that we're implementing in our community. And the idea is that the expectations are known, that we communicate with the parents and the students and prepare them for not just the mask, but a lot of the protocols that we'll be implementing to maintain physical distancing, hand washing, and of course mask use. So that education component is very important, because we want to instill that sense of responsibility and seriousness in our community. We've always emphasized kindness in our school district, and being good to each other and working together to solve problems. This is one of those occasions. So we're already working on that regard. As far as students, when incidents happen regarding masks, we have steps that we're going to be taking. We definitely see the use of a code of conduct as a last resort. Mm-hmm. It's really going to be resolved before that, and working with the parents, including maybe transitioning that student to digital learning before we even start talking about code of conduct and being punitive.
Dr. Nielsen, one woman says she's concerned about children not getting fresh air from wearing their masks and breathing in carbon dioxide all day. What would you tell that parent about wearing a mask all day, 5 days a week at school?
The studies don't support that at all. So my office staff and myself, we put our masks on at 8:15 in the morning when we get to the office. They don't come off until 5:30 when we leave. Sitting here right this second feels really weird without my mask on, quite honestly. It's the first time I've been in a building since March the 13th without a mask on. And that's just because no one else is in this room where I am. So it's a safe situation. It's perfectly fine to wear a mask that long. We've walked around with oxygen sensors on our fingers to make sure of it. So you don't have to worry. Your kid's going to be fine wearing a mask. They're a lot safer and they're more likely to live.
And Mrs. Horton, we have a viewer who is wondering if school employees have received any sort of guidance about the use of homemade PPE, such as face shields, masks, and hand sanitizer. Have you received any sort of guidance from your district on how to handle those situations?
Face mask or anything. They have mandated that we'll have a mask requirement for grades 3 through 12, and K through 12 will be expected.
And I want to bring in Dr. Jenkins on that. You know, obviously we are expecting a lot of students who have opted for the face-to-face learning. They will be bringing in a lot of their own personal protection equipment as well as hand sanitizer. Have you thought about screening that to make sure some of that stuff that's going to be now introduced into the school building is also safe?
Absolutely. We're not asking students to bring their own PPE. They can bring their own face mask, but all of the cleaning materials, hand sanitizers, that will be provided at school. I'm certain some parents may want to give their child something they keep in their book bag as well, but we are not asking them to bring it. We will have it available at school. And we'll also have guidelines around what is an appropriate face mask. It needs to be of a solid material. It can't have holes in it. It can't be lace. Can't have inappropriate words or symbols on them. They can wear their own, but if they come without one, we will give them a face mask as well.
And we also have someone who wants to know how teachers will have enough time to sanitize desks, chairs, and other classroom items in the few minutes it takes students to switch classes. Do you anticipate that being a problem? We'll continue with you, Dr. Jenkins, and then I want to bring in Mrs. Horton on that.
So we do not require teachers to be responsible for sanitizing. They can certainly do that if they want to, but we have custodial staff that can help us keep the spaces as clean as possible. Because children are wearing masks and their hands are being sanitized, I don't believe you can expect that every time a child moves, you're able to sanitize those desks, and we would not be requiring that of our teachers. Should they want to do that, it's certainly not prohibited, but not required.
And Mrs. Horton, you are potentially going to be in the classroom. How do you feel about that? Do you feel like there's going to be enough sanitation going on? Will you have time to sanitize all of those desks and chairs and everything else that students come in contact with?
I think our district has a pretty solid plan with that. They're going to have somebody come in and sanitize at least once when we're at lunch or activity. And then they're also going to have janitorial staff come in and clean the classroom 2 different times in addition to that. And they've offered to provide us, each teacher, with the supplies that we need to clean as well, if we choose to.
And Dr. Griffin, I know here at News 6 we've covered some of your efforts that are going to be taking place in Seminole County in terms of sanitizing your buildings, but we do have a concern from one parent who wants to make sure that all of those chemicals that are potentially going to be used are actually safe for kids and teachers and other people in the building.
Yeah, absolutely. The chemicals that we're using are the ones that are approved to use in schools and to use with children, and that's all we will use in the schools. We can't emphasize enough, cleaning the hard surfaces will take place throughout the day, but we have misters every evening that will be misting every single classroom at the end of the day. But I think the 2 items in front of that we cannot stress enough, face masks, as we've already covered, but students and employees have to continue to wash their hands, to keep their hands away from their face, a lot of training and a lot of reminders. So it's threefold. It's masked, hand sanitizing, and hard surfaces.
All right, and we are getting some more comments right now on our live chat, and this one is going back to really our first question that we started off tonight's town hall. Michelle says she does not believe schools should be allowed to open. She wants to know what members of the community can do to support our local officials in not opening face-to-face. All of you mentioned that now does not seem to be the time to reopen schools. Of course, we have surging cases here in the state. So at this point, is there anything that people in the community can do to stop the reopening of schools? Again, as I mentioned, the state has responded to some of these concerns by saying it is up to the local school district to decide if and when to reopen brick and mortar schools. Dr. Jenkins, we'll start with you.
So I think it's important to remember a couple of things. Number one, the emergency order has not been reversed nor set aside by some additional order. We believe that per that emergency order, while there may be some liberties taken, they may have financial repercussions around how a district's able to actually pay their teachers and run the school system. We've actually had attorneys engaged in those conversations. I shouldn't comment because some of it is pending litigation, but it's not as simple as it seems. So if we would be required to submit a new plan, it would need to then be approved at the state level. So my suggestion for anyone interested in how they can intervene is probably just to make their wishes known at the state level. And I have to stress again, while we have attorneys engaged, the answer is not as simple as it seems, and we believe there are potential financial ramifications and a requirement that we would submit a new plan and wait for it to be approved as well. That's as much as I should probably say at this point.
All right, Dr. Griffin, we have had a few questions about how social distancing will be maintained in the classroom. Can you please explain how many students will be in each class and what those rooms will look like?
The size of the classes will vary, but we have several different setups. We'll do everything we can to separate the students as much as possible. Again, cannot guarantee that it's going to be completely social distance in every classroom, every single period. And again, that's why we are advocating and requiring the use of masks in schools, because I think the students, even if they were seated 6 feet across from each other, students don't sit in rows silent, and the teachers don't sit in the front without moving. Teachers are interacting with the students, students are moving, and so on. So social distancing on buses, hallways, lunch lines are a challenge and really unrealistic, and that's why we are really insisting on the mask use as much as we can inside the school building. Then we're hoping when the students get outside, we really can socially distance the students, let them have some free time without their mask, maybe during recess, during PE, but clearly they have to be socially distanced for that to happen.
All right, Chairman Soto, what happens if someone tests positive for COVID-19 and that person maybe is a student or a teacher in a classroom or in a school? What's going to happen to all the other kids or people in that classroom?
Our protocols are going to be to find out what other students, what other persons in that school, in that environment, could have had contact during the contagious period that the positive person was around them, and contacting those folks and asking for them to be tested, and of course, not returning to the school until those test results are known. For the person that is positive, obviously, they would have to be monitored to see how, if or not they'll be ill, but they wouldn't be able to come back until they're cleared medically. So,
are you going to be requiring a test, a negative test, before they can come back to school?
Well, probably that makes sense. I don't know quite what is going to be the indicator to say that this person can come back safely and not be infected again or infect others. It could be a test, but I think that the science on that is still being developed. But absolutely, I think that once you have a positive test, it may, we also know that these tests have a pretty decent false positive rate, so we may have to retest as well if there's no symptoms. So the protocol is going to be pretty involved. I believe maybe the doctor on the panel may be able to add a little bit to how that would work out.
Do you have any advice, Dr. Nielsen, about what should be done if there is someone in a classroom? Does the whole classroom close down for 2 weeks? What happens?
So if one child, according to the CDC recommendations at this time, if one child does present and they are positive, the entire classroom and anyone that child has been exposed to on the campus has to go home. The other children then have to be tested. It's recommended to be tested 3 days after exposure. Testing too soon will give you a negative result, so you want to wait till your window is in your best chances of actually having an accurate test. One of the problems we have here in Orange County is the availability of tests. To be a good test, it needs to be fast, cheap, and accurate, and easily accessible. That's not very easily accomplished here in Orange County right now, sadly. You're not going to be able to get quick turnaround times. So let's say I've got one kid in a classroom and they're the one who's positive. Well, their siblings in another classroom. Now I'm going to have 2 classrooms down for probably 14 days. Then the teachers, any specials people, any janitors, any custodians, anyone else who's worked with those children. It's not really a matter of if this is going to happen. It's a matter of when this is going to happen. And I think parents need to be ready for that. And if they have worries or concerns and they're unsure if they should send their child to school, it's a good time to say, hey, I'm worried, I'm concerned, let me keep my kid at home.
And Dr. Jenkins, is that the plan for Orange County Public Schools? If a student tests positive, will the whole class be out for potentially 2 weeks, as well as any siblings classes?
So there's a specific protocol. We have to engage the Department of Health for the contact tracing and for the communication. It's all in a decision tree that we have made a part of our procedures handbook for COVID-19. And so it depends on the actual case and what has transpired, and then the contact tracing will help us determine who goes home and for how long. And we have to coordinate closely with the Department of Health.
A lot of people are curious to know how this actual school day is going to work. Mrs. Horton, maybe you can chime in here. People want to know, as a teacher, are you going to be required to teach just in the classroom, or are you also going to be doing the virtual teaching as well, or is that going to be separate? Have you received any sort of guidance on that?
It could be both. I could be doing blended learning. I could do e-learning. We've been asked as a team for our 6th grade team to decide if we want 2 teachers to do e-learning and 2 in the classroom. So it's all going to depend on when they get the final numbers for who's coming to the class and who's not, and when people are going to come back and join, and some students are going to leave. So we're kind of still up in the air.
Chairman Soto, is that the same situation in Osceola County?
I'm sorry, repeat the question.
For teachers, are they going to be required to do both in-class and online teaching, or will there be separate classes where you have a teacher who's just dedicated to face-to-face teaching and then one who may be doing the virtual teaching?
Yeah, there may be opportunities or situations where a teacher would do a digital learning as well as face-to-face. That flexibility is required, obviously, for a lot of reasons, and that can develop as the semester is progressing. Remember what the digital learning experience is going to be like. It does follow the bell schedule. Those students that are selecting, those parents that are selecting the students to be with digital learning would be enrolled in a home school, in their normally zoned school, following that bell schedule. And so it's going to pretty much run parallel to what the face-to-face instruction is going to be like. And so absolutely there may be situations where a student may transition from one to the other, and there may be an educator, a teacher that would be doing both.
Dr. Griffin, this question was specifically for you. Laurel asks whether teachers who return to the classroom will be eligible for hazard pay. Is that something you guys have considered?
We have not considered hazard pay. We are working with our teachers on the best possible schedule that we can. Our master schedulers have the most complex schedule in my career that any group has ever had. And we will have some teachers who are teaching pure Seminole Connect, which is our remote model. Some are teaching pure face-to-face. But we have an interesting dilemma. 43% of our students are returning face-to-face, but 63% of our teachers asked to return face-to-face. So that gives us some flexibility. So in addition to having some teachers teaching remotely or face-to-face, we're going to have many that are doing a blended type model because they want to be there. So they'll have some students who are at home learning remotely while their class is learning at the same time.
And Ms. Horton, this question was specifically for you. Vanessa had a question. She wants to know, what advice and tips do you have for parents who plan on sending their children back to brick and mortar schools?
Advice and tips, I definitely have them practice using the mask and get used to that, and possibly check their temperatures, get used to checking their temperatures daily before they get up in the morning, before you send them to school, and you can start a couple weeks early so they're in that routine. And just be flexible and know that things are going to change.
And Dr. Nielsen, we've heard obviously that children are less likely to be ill with COVID-19, but we've also heard, especially from the governor, that they are less likely to spread or transmit COVID-19. Is that the case?
It's not. Recent research just came out this week, actually, that showed kids 10 years old and up spread it just like a grown-up does. So that's going to be your 5th graders on up. It's also been shown now that anyone down to the age of 2 has a higher viral load, and so they're actually more effective carriers and spreaders than we ever imagined. One thing we've done is we've kept kids at home ever since that March 13th day when we sent everybody home from school and said stay home for the longest spring break ever. By keeping kids away from each other, we've kept the numbers down, but as you've seen across this state in summer camps and in the Georgia camp recently, where over 200 people ended up having COVID, you put kids back together and it spreads.
Dr. Jenkins, one viewer was specifically asking about the Pine Hills community and other low-income areas where residents don't have the means to maybe attend school virtually as much as in other communities. She wants to know, will extra precautions be taken for students and teachers in those communities that may be at higher risk?
Absolutely. For all of our face-to-face situations, we have lots of protocols in place to keep both employees and students as safe as possible. Folks might be surprised to know only 1/3 of our children will be planning to come back to face-to-face instruction, but 45% of our teachers said they wanted to be back in the school setting with students, either doing the Launch Ed program from their own classrooms or doing the face-to-face learning. And so the numbers district-wide match up pretty well. About 1/3 of teachers and about 1/3 of students saying face-to-face is their first choice, those students' parents, I should say. So the issue is going to be whether or not we can get them aligned appropriately at each individual school. So a school in a certain community might have more children that need to come in for face-to-face because the families need that. And in other instances, a school might have very few that are coming in for face-to-face and most of them wanting to do the Launch Ed, the distance digital learning. It all depends. Principals are working to match both demand with teacher assignments this week.
It's like a giant puzzle happening right now behind the scenes. Thank you so much. Reopening schools, your questions answered will continue in less than 3 minutes. After the break, we're going to take an in-depth look at school bus safety and a whole lot more. Keep your questions coming. You can head to our website, clickorlando.com/reopening schools to join our live chat that's happening right now. There you can also find our extensive back to school coverage. We're going to be right back.
Brought to you by the Orlando Law Group.
Welcome back to News 6 Reopening Schools, your questions answered. I'm Lisa Bell, and I'm joined by our panel of experts tonight. Orange County Public Schools Superintendent Dr. Barbara Jenkins, Seminole County Public Schools Superintendent Dr. Walt Griffin, Osceola County School Board Chairman Kelvin Soto, Brevard County Elementary School Teacher Rebecca Horton, and Dr. Annette Nielsen from Treehouse Pediatrics. And I want to thank you once again for all being here tonight. We continue to get a lot of questions into the newsroom. I want to start talking about bus drivers and bus safety. Jose is worried about bus drivers. He wants to know, to our school leaders here, can you explain what's being done to protect bus drivers and other transportation employees? We'll start with Chairman Soto.
Absolutely. We are concerned of all of our employees. Bus drivers do present a very unique challenge. They will be provided, obviously, with all the PPE equipment that is necessary. And as I mentioned previously, there's an education component to all of this that we are implementing, and that means that all of the safety protocols begin at home that morning. When the student goes to the bus stop, they understand about the physical distancing, the need to wear a mask at all times. We will be entering in an orderly way and keeping only 2 students per seat or more. They will be entering and starting to fill the bus from the back to the front and exiting the same way. Of course, and all of the bus will be sanitized in between trips usage. So it does. The whole busing issue is a very interesting challenge, a very difficult challenge, and we're doing everything possible to ensure the safety of our bus drivers and our students.
Dr. Griffin, are you guys going to be doing anything differently than Osceola?
Well, first of all, as I mentioned, only about 44% of our students are returning to school, and I've done many parent WebExes, and I asked them about transportation, and hands down, as many as possibly can want to drive their kids to school. So I think you're going to see much less dense populations on our buses. So from the moment the students get on the bus, they have to have a mask. We have hand sanitizing machines available as soon as they walk on the bus, which they have to utilize. And then they will be spaced out on the bus in assigned seats as much as possible. But the parents who've selected Seminole Connect, a remote option, or Seminole County Virtual School, their students will not be on the buses. So the lighter loads will help with social distancing. The mask will definitely help. Our bus drivers will be provided everything that they need. Many have asked for a shield in addition to their mask. They will have that. As well as the cleaning materials that they need to clean those buses after each run. Our buses do 6 runs a day. So, it's important to keep them clean as the students exit and a new group come on.
And continuing on that theme, Dr. Jenkins, one viewer wants to know, how will the health and safety of paraprofessionals be guaranteed? Are they being offered alternatives to the brick and mortar setting?
Our paraprofessionals will have the same PPE equipment provisions that our teachers have as well. It's very difficult to have a paraprofessional do their job from home, and so we'll need them in the school setting more than likely. Very few exceptions to that because of the kind of work that they have to do, that they need to provide. And I think it's important to note, not just for our teachers, but for all of our employees, face masks, gloves where necessary, hand sanitizers, all kinds of PPE equipment will be provided for all of our employees. And for our buses, I was going to add, Dr. Griffin covered most of this, bus drivers have additional face masks. If a child is about to get on the bus and they don't have a face mask, they will be required to wear one or they cannot ride the bus.
And Dr. Nielsen, a viewer wants to know if it's feasible to test staff and students on their first day and then implement statewide surveillance testing. They're also wondering what level of community transmission is acceptable enough to allow the return of in-person learning.
Right now, Orange County, and as far as I know, Seminole and Osceola County also do not have the ability to test every student and every employee heading back to school this fall. Right now, there's very limited testing available. As far as the prevalence goes, right now in Orange County, we're testing a ton of people, and we're finding that the prevalence rate, the prevalence positive rate, is anywhere from 11 to 13%, depending on the day or the week. It needs to be below 3%, according to the American Academy of Pediatrics, before you should consider returning to a school environment.
Mrs. Horton, we have a question from Yvonne. She wants to know if teachers will enforce hand washing on a regular basis. And to add to that, another viewer is wondering how often temperatures will be taken. Have you been given any guidance from Brevard County on enforcing hand washing or taking your students' temperatures?
Definitely hand washing. They're recommending that we keep on top of that. As far as taking the temperature, it's optional for us as a teacher if we want to take their temperature in the classroom. But definitely hand sanitizing, washing, social distancing.
Okay, and we have some questions now from some parents. Dr. Jenkins, a mom who signed her 2 high school students up for face-to-face learning said she is now having second thoughts. Will her children be able to switch to lunch ed after the first week?
So we've asked individual parents who've made those registrations to make that a 9-week commitment. I would suggest if she's had those second thoughts, she needs to contact her school immediately, because the problem will be trying to rearrange schedules and shifting teachers if we have that constant movement. So we really need parents to stick to that first selection for the 9-week period. There are extenuating circumstances and a reason to make a change. I would suggest she do that immediately.
Okay, and Chairman Soto, how is your district handling PPE? Anthony is concerned there will be a shortage, and he wants to know how this will be handled.
I don't have any information, credible information, that there's going to be a shortage. The last time that I spoke with the district staff is that we will have all of the PPE and all of the cleaning equipment, all of the supply, and the necessary custodial staff to make our plan and function. So I guess that if we were going to be running short, we'd just be looking for other sources. It's something that we need to have.
Okay, Dr. Griffin, we have a question from a woman who opted to have her son do Seminole County Virtual School because her son has asthma. Will they be locked into that choice until January? We just heard Dr. Jenkins talk a little bit about this. We really want people to make a decision now so you can match up staffing and everything, but will they be allowed to make a different choice?
Yes, Seminole County Virtual School is a franchise of Florida Virtual School, and those families will have to stick to their commitment for course completion, which is at about 18 weeks. We have a little more flexibility with Seminole Connect because that's not a franchise program, that's part of our program. And we are allowing some flexibility still at this time, primarily because we're tightening up the mask usage. I know that makes some parents uncomfortable. So we have opened up that if parents who selected face-to-face are concerned about the additional use of masks, they can go to Seminole Connect.
Okay, and do any of the districts have plans to take temperatures for students or teachers before they enter the building?
At Seminole County, we do not. We are learning visual screening procedures. I'll tell you, we spoke about it. I think we would really be creating a social distancing issue. I'm a former principal of a high school with 3,000 students. I don't know how you would do that safely, keeping the kids 6 feet apart while taking their temperatures. So I think we will learn visual screening and then take temperatures of students who we have to take temperatures for.
Chairman Soto?
We're working on having temperature scanners in all of our schools. Again, I want to refer back to our education component, which is very important, about having parents be very aware and proactive in making sure that their student is ready to start their school day. We are exploring and trying to figure out ideas of maybe developing apps that can that parents can use as a daily questionnaire to go through certain steps to see if there's any symptoms that they can go ahead and put into this app, and it could go with an algorithm about, maybe call us or we should look further into this. So in other words, we want to have a very robust protocol to make sure that we don't have any kids that are obviously sick coming into their schools. So it's education, it's parent involvement, and we want to have temperature checks in our schools, and we want to train our staff and our teachers also to be vigilant for those signs.
Dr. Jenkins, will they be taking temperatures in Orange County schools this year?
We've listed it as a periodic strategy. I think what Dr. Griffin said is so important. The risk of having a bottleneck where children are very close together waiting to have their temperature scanned is a far greater concern than trying to actually take the temperatures. And some advisement that says that's not the best indication that a child might have COVID-19 either. And so we've listed it as periodic. We certainly will scan any guests, any visitors that need to be on our campus. And with students, we reserve the right to do that periodically.
Dr. Nielsen, you talked earlier about testing, and we really just don't have the capacity right now to test every student before we start the school year. But what about taking their temperature? You think that should be something that we just do periodically, or it should be done regularly?
So the American Academy of Pediatrics has stated that taking temperatures prior to entering schools is not very effective, because we all know there are parents that give their kids a dose of Tylenol or Motrin on the way out the door just so that they can go to school and make whatever progress they need to make. So take a temperature when you feel like a child is symptomatic is much more effective.
Mrs. Horton, I want to hear from you after hearing all of this discussion. How do you feel as a teacher who's going to be face-to-face, with who knows, 20 students or so and many more people in the hallways? Are you feeling like there are enough protocols in place that you will be safe this school year?
I'm feeling a lot better than I was 2 weeks ago once we've gone through negotiations and have some more things in writing as far as what the district is guaranteeing for us in Brevard. So I feel more comfortable than I did 2 weeks ago, but I'm not 100%.
Do you know for sure when you'll know what your day will look like in terms of whether you'll just be doing face-to-face learning or whether you'll be doing virtual and face-to-face? Do you have any idea when you're going to get some concrete guidance on that?
As soon as we get all the numbers in, we were just had a conversation with our principal today, and she's willing to meet with us and kind of see where we're going, but we still have the number of students that haven't chosen. So we really just need to see what is going to make the best plan for our team as far as 6th grade. So I think all the districts are in the same position.
We've heard from a lot of teachers who are certainly rightly so concerned about their health. They might have a pre-existing condition, or someone in their family has a pre-existing condition. So what sort of accommodations are being made for teachers in that situation? Dr. Jenkins, we'll start with you.
We have every provision in place for 65 and over and those with health issues to be accommodated. Those would be our first individual teachers assigned to teach from home. I want to be clear, that doesn't mean other teachers may not also have that capacity to teach from home, because 62% of our parents want that model, and only 39% of our teachers wanted to be in the school teaching. So we believe we have the capacity for more to be teaching from home, but the first priority are those individuals who both are 65 and above or who have health accommodations. Those are our priorities. We think we can accommodate them. Problem is, Lisa, they're not always matched directly to the school. And so children don't come in the neat little bundles that we need them to in order to make sure we have enough for each teacher that wants to teach from home. So we have to do some creative things. It may be that a teacher who wants to teach from home in a particular school can voluntarily teach a group of students from another school because they have more students learning from home than the teachers that want to instruct from home.
And Chairman Soto, does Osceola have any guidelines in place for teachers who may be concerned about their health and then having to go into a classroom?
Absolutely. I asked that very same question of the staff this morning, and right now it looks very promising that we'll be able to make all the accommodations. And I believe that Dr. Jenkins really explained it very well, what would be probably the policy on almost any school district. And it's always to start with those special cases where we certainly need to allocate those positions to people that really require to not be in an environment with the students face to face because of the high risk. But it's absolutely one of those situations where right now we're handling very well, and it can change, and when it does, it's just going to have to work between the district and the teachers to accommodate them and find creative ways of making this happen.
Dr. Griffin, we're hearing from someone who specifically wants to know about younger kids. Say, for example, you have a kindergarten student or a first grade student and doing the virtual schooling. How is that actually going to work? I know I'm a mom of a soon-to-be first grader, and we have opted for the Launch Ed version in Orange County, but I do have to admit that I think it might be a struggle for my 6-year-old boy to sit in front of a TV or a computer screen all day and be engaged. Have you guys talked about how that's going to work with some of the younger students who are enrolled in the virtual school?
We have in great detail, because it's very, very important. First of all, I don't believe students can stare at a screen for 6-7 hours. So the way that it's going to work, it's going to model the school day as closely as possible. So a certain time, let's say 8:45 in the morning, the teacher will open up the WebEx or the Google Classroom, whatever they're using, greet their entire class, maybe do some whole group instruction, and then task the students with assignments to work on, and then meet with small groups just as they would in their classroom when they work cooperatively. So the teachers normally meet with groups of maybe 5 to 6 students for 15 minutes, then another group rotates through, and each stop along the way they have a task. One of these stops will be the WebEx with the teacher, either checking the work, reinforcing, or learning. So it's going to model very, very closely what happens in our classrooms. There's no substitute for our great teachers face-to-face. We know that. But I think parents will be pleasantly surprised how much better it is than what we did fourth quarter. Remember, fourth quarter we pivoted in 6 or 7 days. We've been working on that since March. It's gotten a lot better, and we'll continue to improve as the year goes on.
Dr. Jenkins, Megan has a question. How will substitute teachers be trained for face-to-face and Launch Ed?
So Kelly Services is our provider for substitute teachers, and they are going through training, much of the same professional development that our other teachers are going through. They are being prepared currently.
And Sherry is also wondering, a question for Dr. Jenkins, how special needs students who require speech therapy or other services will be able to receive that therapy.
Absolutely. So our parents of students with special needs have the same right to choose which model they want their children to receive as well. And so let's say an ESE parent says, I want my child on Launch Ed, then their ESE teacher would be engaging with them through the Launch Ed platform while they are at home. That parent may also say, I need my speech therapy or my PT, my physical therapy at the school setting. And if that's the case, then on an individual basis, they would be able to schedule that at the school as well.
Chairman Soto, we have some parents who are asking if their students are doing virtual school, will they still be eligible for free or reduced lunch? And if so, how those meals will be distributed?
What we're doing in Osceola County with our nutrition services is we're probably going to be delivering meals once weekly for the rest of the week for all of our students. And we're going to work through it in that manner so that there's less disruption. It's easier for logistical purposes. But absolutely, our school nutrition services will be in full swing, providing meals to the students that are doing the face-to-face, but also delivering those meals to students that are doing the distance ed. Probably, like I said, it's going to be on a weekly basis to cover the entire week.
And I think all the districts in Central Florida are finalizing similar plans to make sure those students also get their free or reduced meals. Correct me if I'm wrong there with the other superintendents. I do have a question from Sherry. She wants to know from each of you if you would feel safe sending your own children back to school. We'll start with Dr. Nielsen.
No, I would not at all.
Okay, Mrs. Horton.
I was going to send my son back. He's 16, 11th grade, and I was feeling comfortable because I felt like there'd be fewer kids in the school building, and I figured for high school it'd be a little more controlled. But he doesn't feel comfortable going back to the classroom. So he's highly motivated, so we're going to do the e-learning option. And he knows that he might have to go back to school for some chemistry labs and such. So.
Okay, Dr. Griffin?
I absolutely would, with all the precautions that we have in place.
Okay, Chairman Soto?
Look, I understand that different families and different parents have different situations. We know already how this virus affects different segments of the population in terms of risk factors, access to health care. So I think that for certain folks, I would absolutely, if they were to speak with me and we were to discuss a little bit of these factors, I would say absolutely not. But for others, I believe that, maybe they can live with that kind of risk, maybe their own personal feelings about it. It's worth for them to continue with the face-to-face, and that's why we're doing it. We're going to do it in the most safe manner possible. And so that's why we give choices. That's why we have 3 different ways that a student can continue with their education.
Dr. Jenkins?
So my 2 children are highly social, and I think they would insist on being with their peers and with their friends, but I respect every parent's right to choose what is best for their child and for their family. My children would be going back because I think they would demand it, especially at the high school level. It's so difficult to be isolated for so many of our young people. And I want to acknowledge too, I respect families that have some significant issues around being able to get back to work while their child would need to be at home. And so I respect those individual decisions, and we are committed to keeping them as safe as possible.
Well, we have also received several questions tonight in our live chat about special needs students and students with pre-existing conditions. Can you explain how these students will be protected and what their day in the classroom will look like?
So you need to understand, for our students with special needs, they have what's called an individual education plan. So based on that IEP, the principal and the teachers and the resource individuals, professionals at that school would work through that IEP to make sure their needs are being met. It's based on the individual educational plan for those students.
Can a virtual education experience work for some of those students, or is it, I've spoke with one mom actually today personally who feels like her only option is sending her daughter with special needs into the school for face-to-face learning, yet she is very concerned about COVID-19.
Understandably, we have to give them the same option as any other parent. You cannot say your child has special needs so they can only do the face-to-face. They have to have the same options of any other parent, and then we need to work with them creatively through the educational process to make sure their needs are being met. But we would not prohibit them from selecting to keep their child at home and receive services, or to be at home and then also come to school on certain days for certain services they might need.
Dr. Griffin, how is Seminole County working to accommodate students with special needs?
Yeah, very similar. Every IEP is designed for a customized plan for each child. We do everything that we can pre-COVID, currently, to meet the individual education plans. I think it's important, that all parents have access to all services, and we do everything that we can to make available so that we meet the needs of the individual education plan. when you say special needs students, it's a huge umbrella. And the variants of needs under that umbrella are really dependent on the individual situation. But we have a team. We actually built our program when we started building Seminole Connect. It was really looking at how can we best serve students who need some customized opportunities. So I feel pretty confident that we can meet the students' needs.
Marcus and some other people on our live chat are wondering if teachers will have to use their sick leave if they contract COVID-19. Is that the case, Chairman Soto?
That is the case. Our policy at Osceola County is that we're dealing with this as it would be any other type of illness, and so we already have those protocols. There's not much else to add to that.
Dr. Griffin and Dr. Jenkins, is that the same in Seminole and Orange counties?
In Seminole County, of course, there's the Coronavirus Relief Act, and employees will be entitled to 10 days. Now, what we're going to do, I really don't want our employees to eat up all their sick time, and we're primarily thinking it's going to be our face-to-face teachers who have to be out. So our plan is for any face-to-face teacher who does have to be quarantined and is healthy enough to do so, is to have them stream in to assist a substitute with their students, hence be able to pay them. I'm not in favor of draining people's sick leave because of this, and we will do everything that we can to keep their paychecks intact.
Dr. Jenkins?
We would put the teacher on what we call relief of duty for medical reasons with pay. It would not drain their sick leave.
Okay, and we do have a question about what happens if a student develops a fever during the day. Where will they be kept, and what happens if parents cannot pick them up? Does anyone want to chime in on that?
So in Orange County, we will have both a well clinic as well as a sick child clinic, similar to when you go to a pediatrician if your child is actually having symptoms, and quite often they're in a separate waiting area from a child who's there for a checkup. And so children who've had a scrape on the playground or who need to come and take medication, they will go to a separate area than children who are having some kind of symptom of illness, where we can call the parent to come and pick them up.
Is that going to be the same in Seminole and Osceola counties?
Yes, in Seminole County, we will have a separate isolation area. And immediately upon any symptom related to COVID, we will have the Seminole County Health Department come and help work us through that. Hopefully contact the parent, get the child tested and the help that they need. But we all know, working at school, sometimes parents just can't get there, and that's really the purpose of the separate isolation area. So if a parent takes a little bit of time to get to the school, the child is safe and away from others.
Mrs. Horton, as a teacher, have you received any sort of guidance on what will happen if a student in your classroom starts to present symptoms of COVID-19?
Yes, we're allowed to send them to the clinic, and like the others have said, we'll have a clinic and then a separate classroom that they'll make. So they'll have a well clinic and those that are feeling ill.
Okay.
So they have two separate areas.
We are getting short on time tonight, but I do want to have a final question for each of you. We just want a big general question. What would your message be to parents, teachers, and students as they head back to school in just a matter of days now? And we want to begin with Dr. Nielsen.
I think this is one of the hardest times and hardest decisions a family will ever make. 6 months ago, we never would have been talking about a pandemic. In fact, we didn't know what COVID-19 was. You have to stay ready to move at a moment's notice. It will change. Don't get married to a plan. It's going to change. Go with your gut, go with your heart. Your soul's good. Prepare your child. Put a mask on them.
Mrs. Horton?
I would say that we're all going to have grace and patience and definitely flexibility.
Yeah, flexibility is going to be so key for all of us, as we have learned over the past several months. Dr. Griffin, your message for parents, teachers, and students in these uncertain and scary times right now?
You know, I think there are a lot of unknowns, and it's about being compassionate and being respectful. I respect every parent who's made every decision they have to make. Those are difficult decisions. I understand what you're going through. I can't say this enough. I think our teachers are being unfairly beaten up over all this. There's a lot out there that our teachers don't want to come to work. Our teachers have things that they're dealing with also. Some live with sick relatives, some have sick children, some have health issues of their own, and I think everybody really needs to be compassionate and understanding. We do have enough teachers to deliver face-to-face. I've said right from the beginning, if anyone has any concerns about sending their child to school, select Seminole Connect. That's what it's for. You had a question earlier, what should parents do? I don't think it's necessarily about calling Tallahassee and doing all that. Just take the remote choice, and by having fewer students in the schools, we can do a better job.
Okay, Chairman Soto?
I would tell everyone that is listening to first understand what we're dealing with. There's plenty of information that's been published, reliable information, reliable science, reliable studies that have been interpreted and explained so that anyone can understand what we're dealing with. The second thing is understand your situation and where you fit in and how this can affect you if your child was to become sick or you were to become sick. And then make the decision. I'll tell you, I'll say this. There's right now a lot of effort being put into finding effective treatments and a cure and a vaccination that is that may be within a year from now.
Let's hope so.
And listen, you could recover 1 year of lost education or maybe not the ideal, but this disease can really hurt you or kill you.
Okay, and Dr. Jenkins?
To the teachers, thank you for your dedication for working with our young people. We will do all within our power to support you and to keep you safe, teachers and all of our employees. To the parents, we respect your decisions. We will support you and keep your children safe. Should you need to send them to us, if at all possible, you keep them at home or you transport them on your own. That will help with our safety measures. To the students, I really want to say we're depending on you to take this seriously, because you're practicing these safe habits is going to make a difference, not just at school, but at your home and in the community. So to everyone, if we work together, we will get through these unprecedented times.
Well, thank you so much for joining us. We are out of time tonight. Keep the conversation going at clickorlando.com. Thank you.